Do you find yourself facing challenges with school, work, social interactions, or mental health? Problems like time management, memory, emotional regulation, focus, or even communication? Well, it could be a part of ADHD or anxiety, depression, PTSD, maybe autism. That's because they all depend on something called executive functioning. Welcome to the Managing Mental Health podcast. Join us as we talk to leading psychologists about all areas of mental health, and we hear from real people that have overcome real mental health problems who can now share hope and encouragement for us all. I'm Jamie, social psychologist, author, and trauma recovery coach. Our guest today is Dr. Jerrod Brown. Dr. Brown is a professor, trainer, researcher, and consultant, and the founder and CEO of the American Institute for the Advancement of Forensic Studies. He holds multiple master's degrees and graduate certificates, has consulted on topics related to autism, fetal alcohol disorder, and trauma, just to name a few. He's completed postdoctoral study in leadership and organizational strategy, forensic psychology, diabetes care, neuropsychology, and many other areas that are vital to current psychological understanding. Currently, he is pursuing his fifth master's degree in applied clinical nutrition, and he has conducted over 300 workshops and trainings, published extensively, including co-editing the book Forensic Mental Health, a source guide for professionals. He is regularly featured in magazines, professional publications, and on national and international podcasts. Welcome, Dr. Brown. Thank you for joining us.
You want? Thank you, Jamie. Hope you're doing well.
I'm doing great. Happy that you're here. And just to put this out there, everybody, I'm a huge fan of Dr. Brown's and possibly a little biased since he was my professor during my graduate study in trauma, but I'm overly excited to have him share his treasure trove of knowledge and wisdom with us, not just for today, but this will be the first of a six-part discussion as we take a deep dive into executive functioning. You'll see a list of each episode below in the descriptions. Today, we're going to start with part one of six with an introduction and an overview of executive function. So, Dr. Brown, what is executive function and why is it important?
It's the boss of the brain. And think of it as the CEO of the brain. It really guides the boss with all day to day behaviors. And the reason why I love this topic and it's so important for all of us to learn about because it really guides decision making and problem solving and time management and reasoning and how we do in school. And I do a lot of forensic work, clinical work. And if you are working in that arena with any justice involved populations, people on probation, parole, folks in prison, if you're working with clients in a mental health treatment capacity who are diagnosed with a trauma disorder, a head injury, substance use issues, almost all of those clients are going to be dealing with some level of executive function impairment. And it's not just client based populations that are impacted by this, we're all impacted by executive function on some level. If you skip a night of sleep, your executive function the next day is probably not working at optimal levels.
Hmm.
If you're one that seems to have a lot of caffeine or a lot of sugar or smokes cigarettes or lives a sedentary lifestyle, all of those things can impact our executive function. It plays a huge role in our leadership, our relationships with other people, how we get along in group dynamics. The
Hmm.
list goes on and on and on. And we'll go way deep in the weeds on that, Jamie, but that's just a
Hmm.
really broad overview. And I'm more than happy to go deeper into that if you'd like.
Yeah, that's fascinating because I mean, it sounds like you said, it sounds like it pretty much touches all of us just in everyday life. Um, it can only, it's a wonder how it is impacted even more so if someone is struggling, with a mental illness, a trauma recovery, a traumatic brain injury. I know that's one of your specialized topics as well as TBIs. So, and just you mentioned a few in terms of like school and work and leadership and things like that. What are just maybe some specific examples of how the brain works in normal executive functioning?
We're in a better position, Jamie, to get things done. So have you ever met somebody that really nice person, they're highly intelligent, but they never can get a task done on time. They're
Mm,
always scrambling at the last second. They're never on time. I wanted to point that out because in a lot of cases, you may have a friend or you know somebody or you're working with a client who is very, very competent in terms of having a very high IQ,
mm-hmm,
but that doesn't always equate to having high executive function.
hmm,
Now, on the flip side of that too, you may be working with someone who has a neurodevelopmental disorder, and most of those folks are going to be having executive function impairments. But again, this can occur on so many levels and impact all of us. Chronic forgetfulness is a red flag indicator of executive function, which could be something going on with our working memory, which is a big component of executive function.
mm-hmm,
Have you ever met someone that just doesn't seem to pick up on social cues, or they have a lot of social inappropriateness? Those are red flag indicators too of executive function.
mm-hmm,
Connecting the dots and planning for the future and seeing the forest through the trees. And if somebody always lives in the here and now and never thinks of the future, that might be an abstract reasoning deficit, which is a component of executive function, which all of these things we'll be going a lot deeper into
mm-hmm,
coming up in this series.
mm-hmm,
Or impulse control, big red flag indicator. Under the umbrella of executive function, there's something called inhibition, and that's our internal parking brake. So when that's working properly, we're in a better position to pause, slow down, think through things,
mm-hmm,
make good decisions. When somebody has disinhibition, which is very, very common with folks with head injuries, people in the justice system, folks with
mm-hmm,
drug and alcohol problems, what's going to happen? Their internal parking brake is not working, so they may go from 0 to 60 in a second. They may be more likely to be really impulsive with their decision making. I consulted on a case a while ago where the client, when he went to the buffet, he'd have 10 plates of food. That's an example of poor self control, amongst other things. Those are all indicative of executive function impairment.
mm-hmm,
Time management, as I mentioned before,
mm-hmm,
disorganized thinking. You ever go to someone's house and their house is just in complete disarray always? That's just how they live their life.
mm-hmm,
Probably rooted in executive function, to be honest with you, because we need good executive function to stay organized, to put things away, to manage our time effectively. Poor stress management is linked with lower levels of executive function as well. So again, the list can go on and on and on. But
mm-hmm,
when you have a client or you know somebody that has really low levels of executive function, it can increase their fear response. They can have a really low frustration tolerance. So they kind of you seem like you're walking on eggshells around that person. They just seem to just do things that don't seem to be in line with the rest of the group. They're always making mistakes. They don't seem to learn from their mistakes. They try hard, but they don't seem to be able to succeed that well. And this can actually contribute to more anxiety and depression, shame and guilt and worry, to name a few. And in some cases, when that happens and the person doesn't have good coping skills, what do they turn to in some cases? Sugar, alcohol, drugs, gambling in some cases.
mm-hmm,
All of these things are supported in the research literature as well. And there's literally been thousands and thousands of studies done on the topic of executive function over the past several decades. So it's a big topic. It
Hmm.
has tentacles in all fields, but it's especially important when you're working with people with mental health, chemical health issues, and justice involved individuals, to name a few.
Hmm. This that was interesting that you said that even though we're talking about what's coming across as a cognitive function, it's not really tied necessarily tied to IQ. So it's not a matter of intelligence. It's just this inability, I guess, to, you know, to keep certain things separate or keep certain things going in the right direction, so to speak. Is there, would you say this is more that the executive function is, or especially the dysfunction, is it more considered a symptom of a mental illness or neurological disorder, or is it just coexistent, or do we not know 100% for sure?
I'll give you an example. So I do a lot of work in the area of autism, fetal alcohol spectrum disorder, and brain injuries. And
Mhm.
pretty much everybody with one of those diagnoses is going to have some level of executive function impairment. And with the IQ, just want to go back to that for a second.
Mhm.
So it doesn't always have to relate to IQ. Now, if somebody has really low IQ, typically they're going to have executive function impairments, but it doesn't mean that someone that has high IQ is going to be exempt from this. It can go all over the map. So
Mm,
just know that IQ isn't always a factor, but it is a factor in some cases. It really does co-occur, and it is a classic symptom in many, many disorders. And if we're talking about this through a mental health lens,
mhm,
the more someone is depressed, the more executive function impairments they're probably going to experience. And I know in
mm,
future episodes, we talked about maybe doing some kind of neuroscience stuff around this. And if you look at the neuroscience aspects of depression,
uh-huh,
there's a lot going on there. Gut brain axis dysfunction,
mhm,
inflammation, neuroplasticity changes, all of these things can erode that person's thinking and
mhm,
really exacerbate some of these things we're talking about. Because when someone's depressed, in a lot of cases, they may not be sleeping well.
yeah,
Poor sleep makes this worse. For some people with depression, they may turn to really fatty, salty, highly processed foods to cope.
mhm,
Those kind of foods, in and of itself, have been linked with more executive function impairments. So we have to look at this through a variety of lenses:
mhm,
neuroscience, biochemical, sometimes genetic,
mhm,
but also looking at that client's overall lifestyle factors. How does that client live their life? Are they getting up every day and maybe exercising, eating healthy, being around positive people? Or do they sleep all day long? They miss natural sunlight. They skip a lot of meals. They're dealing with blood sugar dysregulation. Maybe they're chronically constipated. They smoke cigarettes.
mhm,
They're misusing caffeine. All of those lifestyle factors can make this worse. So it's hard to point to one specific factor
mhm,
why executive function impairments are so high in certain populations, but it likely is a combination between lifestyle factors, biochemical, neuroscience factors, and not to get too complicated today, too, but prenatal factors have a lot to do with this as well. What happened to that client even before they were born? And looking at what was going on during the pregnancy process has a lot to do with this as well.
mm. Yeah, I know it's fascinating how, there's so much information about prenatal influences and, some of the things that we read about and studies from the past have discussed, debated this genetic versus environment issue with a lot of mental issues and emotional issues. And, you know, a lot of that has kind of come to light in terms of that um, prenatal influence and what's coming through the mother's system going into the child, and not just drugs and alcohol, which are somewhat the obvious answers, but what's in the food, like what you're mentioning, the types of food and all the preservatives and uh, even how stress. on the mother, you know, if extreme or regularly occurring, can have that effect. So, wow, this is interesting. So, it really just kind of boils down to just overall brain function and all the things that we kind of probably take for granted on a daily basis that we do. All of these things can possibly be affected by these different factors, and which boils down to executive functioning. How are we thinking and performing? Um, does it? And I know we're going to go into a little bit more in the neuroscience, so not going too deep in that. But would you say executive function is more in one part of the brain, or it just touches all areas of the brain itself?
Well, when we get the like kind of the neuroanatomy, functional neuroanatomy, a lot of the research really points to the prefrontal cortex, the frontal
Mm,
lobes, and when you think about the frontal lobes, prefrontal cortex, they're involved in these higher order cognitive processes. So when you think of those higher order cognitive processes, what comes to mind? Decision making, how we regulate our behavior, how we regulate our emotions, our thinking, our social behavior. Those are things that we want to be
mm,
aware of with the prefrontal cortex.
mhm,
But it's interesting too, is the research absolutely is pretty clear on this. Executive function plays a role in the development of all kinds of other things as well. Theory of mind is one of them. If
mm,
your audience has never heard of theory of mind, that really relates to perspective taking. Gave a training on this a few years ago about the similarities and differences between theory of mind
uh-huh,
and executive function. They're separate entities, but they complement one another. Good executive function also supports healthy emotional regulation early on in life.
uh-huh,
It really promotes good social competence. It plays a role in our moral development, and it helps kids get ready for school as they enter into kindergarten.
mm,
So, what can we do to support this early on in life? Well, supporting the pregnancy process, understanding the first 1,000 days of life research, which is day one of conception,
mm,
all the way up to age 2. And it's all common sense if you think about it. Children that are raised in a kind, loving, supportive home, the pregnancy was healthy, they have a good, rich, stimulating environment, they're eating healthy, they're getting good sleep. Those all play a role in healthy executive function. On the flip side of that, if a child grew up in a home where there's a lot of abuse,
mhm,
chaos, trauma, hardship, all of those things, it really can play a role in impacting this. And you'll find tons of research on child maltreatment,
mhm,
the adverse childhood experiences literature, and
mhm,
how that can exacerbate various executive function deficits. So, for example, working memory can be impacted. That's a component of executive function. That's our brain's post it note.
mhm,
Cognitive flexibility has been shown to be impacted by childhood trauma. Think of cognitive flexibility as you're driving down the road in your stick shift car
uh-huh,
and you can shift gears no problem when you speed up, slow down. Cognitive flexibility problems in the brain really mean you can't shift that well. And it can really come out as the person being really stubborn,
uh,
rigid, their way or the highway. They're really inflexible in their thinking. Child maltreatment has been linked with more planning deficits as that person gets older,
mhm,
or attention problems. And it can also impact theory of mind deficits, which again relate to perspective taking. And it does relate to empathy as well. So the more we can understand the role and impact that trauma has on this as well, will be very, very helpful. And we'll touch on that in some of those
mhm.
upcoming episodes too.
Yeah, awesome. Yeah, it sounds like pretty pretty much every area of psychology plays an important part, and it depends on this executive functioning and understanding, uh, understanding what impacts it and how it comes out behaviorally. Because many of the things you mentioned, even like the little things like the stubbornness and inflexibility and things like that. People may just see that as, oh, well, they're just, a jerk, or this is just a personality trait or whatever. And you may not know that, inside there's something else that has influenced that and is driving that. So,
Yeah, you come across a client like that or somebody or a coworker, try to stay curious. There could be
mhm,
something going on through that neuroscience lens, and it really does permeate into so many other things. And this is why I studied this topic so much, is because it really goes to the heart of goal planning, goal achievement, long-term success. And if you're like a practitioner listening to this and you have a client who just can't seem to achieve their goals, maybe they're really good about verbalizing what they want to do, but they can't put it into action. And
mhm,
they always have a history of not completing something. They can't hold a job. They're in and out of treatment. They're in and out of jail and prison. Look through an executive function lens. It's not going to be the only thing going on, but it should be at the top of the list to consider,
mhm,
because poor executive function gets in the way of long term success and goal achievement.
mhm. Yeah, I think that's extremely important for professionals in the helping field to keep in mind. I know when we were doing our master's work, that was one of the main themes throughout the program was having a trauma informed lens as you work with people. And so this is another, very important consideration as you have clients and you're noticing those things that you mentioned is okay, let me be curious, like you said, about executive function. This may be present, which may be in in coexistence or because of some other issue, but it's definitely something to look for in a pattern sense, like if you see in that type of thing, these types of things repetitively. um, yeah, very very good information
Thank
for
you.
professionals, definitely in the forensic field, like you mentioned, in the therapeutic field, even medical doctors. I would say even leading into um, elderly care once a person is needing, more daily care, more routine care. Um, I know there's a lot of science in, dementia and Alzheimer's and things like that. That sounds like the executive function is probably one of the first, I guess, one of the first signs, so to speak, or one of the first areas affected more so once those things kick in.
Going to have profound executive function deficits. And
Hmm.
just to plant the seed here with what you just brought up, anosognosia would be a topic all of you would want to be aware of too if you haven't heard that term.
Hmm.
Most folks with neurodegenerative disorders are going to have that. High percentage of people with schizophrenia, traumatic brain injury, very common. And anosognosia is just basically that client lacking the awareness that I even have Alzheimer's or I even have schizophrenia.
Uh,
It's not denial. Their brain literally tells them, I don't have this diagnosis.
hmm.
My family's telling me this. My doctor's telling me this. They're all crazy. I'm not taking meds. They're trying
Hmm.
to trap me here. And it really is a recipe for all kinds of not so good stuff. I've given a lot of talks on that topic, and it's the
Hmm.
number one reason, according to research, why people are not successful with treatment. It's called anosognosia.
Mm. Yeah, that's interesting too. And that goes beyond normal denial, which is a stage of grief. And a lot of times when people first learn of a condition, a diagnosis, especially something that's you know lethal, that like cancer, a lot of times, or dementia, something like that. There's this denial that sets in as a part of that. It's like, oh no, this can't be real, or this can't be happening to me. But you're describing it's the next the next level beyond that. It's just total. This doesn't exist, and this I don't have this. Um,
Denial, self-protection,
hmm
anosognosia, an organic kind of something in the brain is not clicking properly,
hmm
and it relates to lack of self-awareness and
hmm
metacognition deficits, a whole bunch of stuff. And the cases I consult on that where they're on civil commitment and they're coming out of a forensic state hospital, nearly every single one of those cases I've consulted on, they have some level of anosognosia, which then gets in the way of medication compliance,
Oh
being
yeah.
successful in a group home, listening to their probation officers, and having
hmm
more conflict with family members. And some research points to the fact that folks with that are more likely to become homeless, unfortunately. They're
hmm
more likely to call crisis stabilization lines, go to the emergency room. Domestic violence is higher.
mm
It's a really fascinating topic. Love to dig
hmm
into that in a future episode with you too. It's
Sure. Yeah, that's something that just even the terminology, I don't think is widely known.
you
Definitely among, you know, and the higher professional levels, I'm sure, but general public, no, we probably don't hear that. We see like, the serial killer shows where the people are like, oh, I'm not violent. I'm not a serial killer. I'm not this or I'm not that, and which could very well part of it could just be denial, but or
probably a little different. I would put that and look at the dark tetrad. That
mm,
comes to mind when you say that. The dark tetrad,
uh-huh,
psychopathy, Machiavellian, sadism,
uh-huh,
and the narcissistic traits.
mm,
Those are big four you'd want to look at when you talk about serial killers. There's a whole bunch of other
yeah,
good stuff to be aware, but
yeah.
yeah.
Okay, cool, cool. All right. Well, wow, that this is great. I think we're going to learn a lot in discussing this topic, and I hopefully it will help people, especially in the professional field, to work with their clients, but also help people that have just family members and loved ones that are dealing with various conditions and issues to give a little bit more understanding of okay, they're not they're not just being this way because they're lazy or because they're being difficult, that this is actual functioning of the brain that has been affected and requires a little bit more patience, a little bit more understanding, and some some life skills learning, which we'll get into. For our other episodes, we're going to look at the clinical and forensic considerations. We're going to look at implications for poor health outcomes, the neuroscience perspective, a topic that's really interesting, and that's neuroplasticity. I love even just reading about that, so that will be interesting. And then end up with healthy lifestyle practices, which I think will be very beneficial for people.
I'll talk about health coaching in there and lifestyle medicine as well. There's some really
Okay.
good research on if we can take those two bodies of research, put them together,
hmm
and apply it, it's going to lead to better outcomes. And if you're on the fence too, anyone listening to this, you're still thinking, well, I don't think it really applies to me. If you supervise people, if you work with people in any capacity, it helps you better understand thinking processes, group dynamics. It can prevent burnout or play a role in helping people reduce burnout professionally in parents.
Mm-hmm.
It's very, very important because what's one of the first things to go when we're burnt out? We're more snappy. We're
Yeah.
more irritable. We don't sleep well. Our guts off. All of these things make executive function worse. And it's a spiral and a snowball effect. So the worse and worse it gets, the more bad decisions we make, the more impulsive we get, and
Yeah.
just a vicious cycle.
Yep. Absolutely. And the sleep deficits, the impact of that on things like this, especially the executive functioning, is something I think we all just kind of take for granted, and that just sort of gets glossed over. We tend to think, well, if I get a few hours of sleep, I'll be okay, or we don't really understand the importance of that. And mental health and just everyday functioning. So yeah, that's a definitely important piece. Well, I think that's a good start for us. We have a really good understanding of what executive functioning is, what it does, the aspects of our life that are controlled and affected by executive functioning. Got a good taste of some things that are going to disrupt that and some implications for those. And so we'll continue this series for the next few weeks and work through those topics. Thank you so much, Dr. Brown. We learned a lot, and I can't wait for the rest of the series.
Jamie, thank you for the great work you're doing. Thank you, everyone. Look forward to being back.
Audience, join us next time for the rest of this amazing 6-part series on executive functioning. As I said, you can find a list of each episode in the description. I hope you learned something new. If you did, let us know in the comments. What did you learn? What questions do you have about executive functioning? Put those in the comments as well. Be sure to subscribe, like, comment, and share to stay connected to this community of mental well-being as we all learn and grow together.